All right, welcome to what to expect during delivery. Now, when we talk about what to expect during delivery, we can give you a roundabout. This is what usually happens, but we don't really know what's going to happen when delivery occurs because every delivery is different. Every single person's body is different, and guess what? The stage of your state of body is different every single pregnancy. So if you were to have another pregnancy and another delivery, it may not look anything like the one you just experienced. So this is an overview, generally, of what occurs during labor and delivery. Okay, and we'll talk in some details. Feel free to ask questions along the way because there are so many different aspects, and I'm sure you've heard many different things as well from a lot of different people who've had a lot of different babies, and everybody's experience is different. When you go into labor and delivery, you kind of know how it's going to go. So it's nice to have a coach there, or a doula, or a birth partner, or somebody who can kind of help you with the transitions when you thought it was going to be one way and it turns out to be another way. It always helps to have a partner there to help you with that transition because you're so psychologically and emotionally and physically involved in what you're doing. If your anticipation says this is going to happen and then it doesn't, it changes, it's nice to have somebody there to reassure you and let you know that that's okay. If it goes a different way, this is how we're going to meet it at its expectations, okay? All right, so what to expect during delivery. All right, so stage 1 involves early and active labor. In early labor, what do you think might happen in early labor?
You experience, your water breaks, you experience contractions.
You're all of a sudden realizing this is happening. I'm actually in labor. So let's go through a couple of the steps of stage 1 labor. During stage 1 of labor is when you will begin to experience regular and consistent contractions. The cervix is beginning to dilate, soften, shorten, and thin. So that cervix is long, thick, and hard, and it's closed up to help protect baby from bacteria and all kinds of other things that might get up there, okay? So when you start to go in labor, those contractions help to soften the cervix because it's long and hard. So it starts to get soft and supple because change is happening inside of that cervix. And it is your hormones that are released and the weight of the baby, position of the baby, the time that you have been pregnant, that cervix is starting to go, you know what, it's time to change, it's time to open up, it's time to let baby come out, the time is about up. So it starts to get really soft, and then it starts to shorten. Those contractions that you have help for it to shorten up, and then it helps it to open up, called dilation. So what is it called when the cervix starts to shorten? Does anybody know? Effacement. So when the cervix starts to shorten, that's called effacement. It softens, it effaces, and then dilate means it starts to open. And we are looking for a large opening as much as possible. We don't start pushing until we are fully dilated. It's so, so important. All right, and that first stage is the longest of the 3 stages. It's actually divided into 2 phases, early labor and active labor. So let's talk about that stage 1, early labor. So during early labor, your cervix opens, dilates, and thins out, effaces. You'll likely feel mild, irregular contractions. That doesn't mean that something's not happening because they're not regular. Every time you have a contraction, your body's doing something. Okay, so always take hope in every contraction that you have. Something is happening, change is happening. That's good things because that's the closer we get to see baby. As your cervix begins to open, you might notice a clear pink or slightly bloody discharge from your vagina. This is likely the mucus plug that blocks the cervical opening during pregnancy. So during pregnancy, that opening is blocked, like I said before, to help protect baby. So the bacterium does not get up there to baby, and baby is nice and soft and protected, and that's what mamas do for their babies. We protect our babies, even though we don't realize it. What else is that sometimes called, that slightly bloody discharge from your vagina? Sometimes they call it bloody show, yes. So these are all terms that's super important for us to know, so that when we hear the doctor or the nurse or nurse practitioner saying these things, we know what that is, and we don't feel scared. What's bloody show? Well, that's that mucus plug, all right? And so if you lose that mucus plug, does that mean that labor is, here it is, we're in labor?
Yes? No?
Not
That is your
necessarily. Not necessarily, but it is a sign that it's coming. And so it helps heighten our awareness. And so that's good to always note it, to flag it. Hey, this is coming. All right? So for first-time moms, the average length of time for this phase varies hours to days. It's often shorter for subsequent deliveries. Every delivery, every labor is different. But for first-time moms, sometimes that labor is a little bit longer. And that's okay. Your body is just trying to figure it out, trying to get in the groove, and just takes a little bit longer. Sometimes, not all the time. All right, contractions. A contraction is a tightening of the uterine muscles. Belly will get very hard and may look or feel like a rock. They typically come in waves from side to side, top to bottom. You will need to time your contractions. Begin timing them from the start of one contraction to the start of another. When they get to be 3 to 5 minutes apart, lasting about a minute, for about an hour, it's time to head to the hospital. Don't forget to call your physician. Let them know what's going on and see how you feel. If those contractions are not getting harder and harder every time, wait. Labor is much better done at home than in the hospital. As soon as you enter that hospital bed, they're going to take a look at the clock. And they have a time that they want you out of that bed. So it's better to labor at home. Know that those contractions are getting harder and harder every time. And then it's really, really smart to go into the hospital when you feel those contractions getting harder and harder every time. Tip is 411, 4 minutes apart, lasting a minute for an hour. Call your doctor to let them know you're on the way. Super important. Just don't show up. Everybody needs to kind of know and be aware. They can pull your file, know what's going on. That's smart. All right, Braxton Hicks contractions. Braxton Hicks contractions are false labor contractions that can happen in the body's preparation for labor. So it's practice, right? Your body is practicing for real labor. It's great stuff, great stuff. That doesn't mean that nothing's happening. When you have Braxton Hicks contractions, a lot is happening. There's a lot of preparation going into it. So even though it's called false labor or practice, that doesn't mean that there's not progression going on, okay? Everything that happens in there is for a purpose, and maybe it's helping everything to just soften up or just to get used to the real contractions that are coming. So Braxton Hicks are great opportunities to also stop and practice your slow breathing, practice any type of relaxation, imagining you are somewhere else on a beach, your favorite place. That visionary really helps you to relax when you're actually in labor and delivering. Okay, so practice it. See if that works for you. If it doesn't work for you, try a focal point. Try looking at a focal point and slow breathing at the same time. Or maybe you just need to close your eyes or be self-centered. Just center yourself. Practice your breathing during those Braxton Hicks contractions. Okay? Even though you recognize that that's not the real thing, you can practice everything else at the same time that your body's practicing those Braxton Hicks. It's great, great practice. So they last around 30 to 60 seconds. They're irregular, infrequent, and unpredictable, so they may come when you stand up from sitting down, when you roll over in bed, when you have to go to the bathroom really bad and it's been a while, you shouldn't have waited, but then your uterus is kind of irritated a little bit, and so there's that tightening. Those Braxton Hicks contractions come. They're more uncomfortable than painful. They're really not painful. They're just tight, right? And if you're unfamiliar with it, it may be more uncomfortable, but when you have those real contractions, you'll be going, oh yeah, Braxton Hicks for nothing. So it's just really tight. It's not painful. Do not increase intensity or frequency. So they don't get harder and harder. They feel about the same every time. I think they feel different the further along you are. They're going to feel different because your uterus is a different shape. It's holding different weight. So there's that. Do not increase intensity and frequency. Usually stop if you change position or activity. You get in there, you relieve yourself, you go to the bathroom, and guess what? Those Braxton Hicks contractions go away. So that's a good thing. Okay, so we're going to talk about the differences. Pay attention to this because it's coming in the quiz later. Talking about the differences in Braxton Hicks versus true labor. So Braxton Hicks feels like tightening or very mild cramping. True labor is intense, stops you in your tracks. So you're walking across the room, that's a real contraction. It brings pain, it's tight, you stop, you have to breathe through it maybe. You don't practice breathing through it, you need to breathe through it, okay? So that's what it means, stops you in your tracks. The Braxton Hicks has no regular pattern, and true labor is regular, gets closer over time. So you're having those true contractions every 5 minutes, every 4 minutes, every 3 minutes, and they get harder and harder. Braxton Hicks goes away with rest, hydration, position changes, and time. True labor, nothing makes them stop. They just keep coming. No way out now, right? You got to go through it. Braxton Hicks do not feel stronger over time. True labor gets stronger and more painful. Braxton Hicks are localized in the lower abdomen and groin. And true labor starts at the back and moves to the abdomen, depending. Everybody's labor is different, so not everybody's pain for contraction starts in the back. I had one, and all of my pain was right here and down into my cervix. So it varies, but you will know. Trust yourself. That pain is something that's different than just regular Braxton Hicks. Okay, those are the differences. Cervix dilation. So we're going to open up, right? We're completely closed to protect baby. In early labor, we dilate 1 to 4 centimeters. Super small, right? 1 is like the tip of your finger. And then here is showing 2 centimeters is like a cherry, 4 centimeters is like a lime slice. Then active labor begins and you go to 5 to 6. Now all this time your contractions are increasing in strength. They might feel the same as far as length, but they're increasing in strength, all right? Which is a good thing. It always makes me really excited because yes, it's coming. This is real and baby is going to be here before you know it. And then 10 centimeters is fully dilated and ready to push. And that they show is as big as a bagel. Once you're dilated to that full 10 centimeters, it's super exciting. And the nurse may ask you to go ahead and push, or the doctor may say, hey, go ahead and push. Not necessarily do you have to push at that time. There are some other things that can happen at that time that are super important that will help you with your pushing. What is it, Cheyenne?
Changing position.
Well, changing position, being in a comfortable position to push, that's true. What else? Something else that's going to help you push. You are mentally pushing. Yes. When you bear down, there's something else that comes from the inside of you.
The urge.
The urge. There it is. So when you get the urge to push, your body is doing it along with you intentionally doing it. So everything is working together. You're all the way open. Your body is pushing and you are intentionally pushing with those muscles, okay? Something super important when you're pushing baby out, you're not done when head is out. You gotta keep pushing all the way through. Push the entire baby out. It's better for you, it's better for your repair process, and it's better for baby, right? It's much better for you to push baby out than for doctor to pull baby out. All right, so don't stop pushing. Even if they tell you to stop pushing, you don't have to push anymore. We got this. No, your mama, push that baby out. Okay, so that's dilation. Good stuff. All right, stage 1, early labor. To promote comfort during early labor. So you might think, these are real contractions. I think I'm in labor. Okay, go for a walk. Try to put it off a little bit. Do some cleaning, do some other things. Take a shower or a bath, unless what? You can't take a bath if what? If your water is broken. So if your water is broken, you can't take a bath. Take a shower though, it feels great. And you'll be glad, because once you get to the hospital, they might let you take a shower, but they're gonna want you to be hooked up to every single thing, listening to baby, measuring your contractions. They wanna put an IV in you, all kinds of stuff. You can listen to relaxing music, just help you relax. Try breathing or relaxation techniques taught in childbirth classes. I'm teaching you those. Those are awesome. Breath helps you, not just through labor and delivery, but breath helps you through every stressful experience you have in your life. Anytime you feel anxiety, anytime you need a little extra patience because baby is crying and crying and crying, embrace these relaxation techniques that I show you, that I teach you, your breathing. All of these things will aid in your mental capacity. It's going to help you tremendously. And then change positions. Changing positions is going to help your comfort. It's going to help baby come down. We are strategic in the positions that we take when we're in labor so that it opens up the hips and helps baby shimmy down into the birth canal. Because that means you have to do less pushing. We want the baby to descend. We want our hips to be open and facilitate that. If you're having an uncomplicated pregnancy, you may spend most of your early labor at home until your contractions start to increase in frequency and intensity. Your healthcare provider will instruct you on when to leave for the hospital or birthing center. If your water breaks or you experience significant vaginal bleeding, call your healthcare provider immediately, okay? So it is normal when you are getting ready to deliver to have bleeding, right? Baby's coming out. Lots of changes are going on in there. There's blood. There just is. But if you are just beginning your early labor, you should not be bleeding. You may have that bloody show, that mucus plug, that type of thing, but it should not be bright red, lots of blood. That is an emergency situation. I would call 911. Okay? As your doula, I would call 911. All right. Water breaks. Sometimes it feels like you're peeing on yourself. Sometimes. Your water starts flowing down your leg or gushing out. These are possibilities. If water has broken, you should deliver your baby within 24 hours. Why?
Because you could get an infection.
You could get an infection. You could get a fever, and it could affect the baby in some way. They will give you, if it takes longer than 24 hours, they will give you antibiotics. It is best to deliver baby within 24 hours. If you are in the hospital and your water breaks and you still haven't had baby within that 24 hours, what can you do to mitigate any problem afterwards? You can request something.
Pitocin?
Antibiotics? I'm sorry?
Antibiotics?
That's it,
Oh.
right there. Antibiotics. You can request antibiotics while you are still in labor to help mitigate any problems afterwards, all right? So don't be afraid to ask for those things. Head to the hospital even if contractions do not meet contraction criteria. So if your water is broken, you should probably go ahead and go to the hospital, even if you have not had a lot of contractions and they're not getting harder and things like that. They can give you Pitocin. They'll test you when you get there to see if it's really amniotic fluid. And then they will probably hook you up to some Pitocin, which is a synthetic, not irritant, but a stimulant. And it just kind of gets your contractions going. I've had Pitocin many times. It's not as scary as you might think. Remember to call your doctor and tell them you're on your way, of course, so that they can be prepared for you. When you walk into that labor and delivery ward, you want them saying, "Oh, Mrs. Grumbles, welcome. We were expecting you. We've got your room all ready." And you go right in. And all that takes is a call. You just call them and tell them you're coming. Okay, when you arrive at the hospital, go to the admitting desk. If it's after hours and the hospital has closed its doors, then go to the ER, where they'll have someone from labor and delivery come and get you. I always walked up to the labor and delivery ward. I never had anybody come and get me. I was about to deliver the baby in the elevator, and nobody came and got me. I got off the elevator, and I was like, "Hi, nurse's station." She was like, "Labor and delivery? You go down this aisle. Turn that, go down there, and then take another turn, and there you are." And I was like, "Really? Oh, I don't have time to wait for you." And so I just went. And I had the baby 20 minutes after I got in the bed. So I was fully dilated at that time, and she didn't have a wheelchair ready for me. Sometimes you don't have time to wait for other people to help you. You have to help yourself. And so you just do it, right? But if you have the time, let them wait on you. Let them bring you a wheelchair. They will wheel you up there. They will help you. They will care for you. It will be great. Once admitted, you're hooked up to monitors and put in a gown. Like I was telling you before, they're going to want to listen to baby. They're going to want to measure your contractions all the time. Contractions, heart rates of mama and baby, and cervix dilation are monitored. So how do they monitor your cervix dilation?
They do cervical check.
They do a cervical check. So they're going to reach up inside you, and they're going to feel your cervix, and they're going to see how dilated you are. It's not fun, but I want to know. I'm curious. I want to know. I've been working hard here. Tell me how dilated I am. I want to know. So it's a very important piece of information and a very important thing for us to go through. All right, they will draw blood to check for several things like blood type, Rh positive, and etc. What if you're Rh positive?
You have to, I know my sister was, and I think they had to I don't remember what they did, but it was like a lot of extra additives. I don't know.
Mm-hmm.
Did they have to give like a blood infusion or something?
Nope.
I don't know then. They have to do
Simple
something.
antibiotic.
Oh,
A simple
I
antibiotic.
was overthinking it.
So sometimes people get really freaked out because they're Rh positive and they're worried about the baby. The baby's going to get sick.
What is that?
Not anymore. It's something found in your blood that the baby will not have, but through delivery it can get mixed. And it can affect the baby in a very negative way. But we've found a way to mitigate that. I didn't, medical professionals did, and they'll just give you an antibiotic. So it's very important that they take your blood, send it to the lab, find out all those things. If you have time. My third baby did not give them time, so it's a good thing that everything was fine. All right, stage 1 active labor typically lasts 4 to 8 hours, depending. I think a lot of this depends on the effacement of your cervix. If your cervix, and when they do a cervical check on you, you need to know 2 things, 3 things. Is my cervix posterior or anterior? When you're pregnant, your cervix gets long, thick, hard, closed, and it turns posterior. It's an added step to help protect baby. So you need to know, what position is my cervix, posterior or anterior? It could be medial. Then you also need to know, how dilated am I? You're in there anyway, just tell me how dilated, and how effaced am I? Am I 10% effaced? Am I 20% effaced? Am I 30, 50? Once you hit that 60% mark, you're on your way. You're gonna start dilating much better. All right, because that effacement, I think, keeps a lot of the dilation from happening.
Effacement is when your cervix is getting thinner?
Yeah, shorter. Shorter. So, okay, where were we? Okay, contractions will become stronger, closer together, and more regular. Skip this one. Cervix will dilate from 6 to 10. Legs might cramp, may feel nauseated, and feel more pressure in your back. Your water may break if it hasn't already. Pain medications can be given during this time through an IV or an epidural. So there are some IV pain medications that they can give you. It lasts only a certain amount of time. It does help. It helps you to be able to relax and maybe get some rest. But they can only give it to you a couple of times. They can't keep giving it to you, okay? So sometimes you tend to get used to that relaxation, and you don't want to enter back into the hard part of labor. So you have to mentally prepare yourself for the pain coming back in the end, all right? Or you can choose to have an epidural. And with that epidural, I can't remember if the next slide talks about it. Yeah. Okay, so the hospital will ask you if you want pain meds in an IV, epidural, or no pain medication at all. Is anybody planning on doing no pain medication at all? Can you change your mind when you get there? Of course you can change your mind. But when you set out with your mindset and practice all the things, you set yourself up for success. So, yes.
What do you think are the benefits of not using pain medication?
A lot. Number one, you are aware. You can feel everything. On the bad side, you feel all the pain. On the good side, you feel where baby is. You feel all your pushing contractions. You're not pushing needlessly if your urge isn't there. You can feel the urge. So as soon as baby is born, you get up on your feet. You walk away. You take a shower. You do the things that you want to do. It's less inhibiting. It was very powerful for me as a woman. I had my first baby emergency C-section, and then after that, I had all VBACs. And so it was very empowering for me to not use any pain medication. And I did it before. Women have done it for centuries since the world began. Well, since Adam and Eve anyway. So I knew I could do it. But you have to embrace the correct techniques to set yourself up for success, right? So you have to use your breathing techniques. You have to figure out what works for you. Should I use the visualization? Should I use the focal point? Focal point worked for me. Should I turn in and just concentrate in myself? I couldn't do that. I actually really needed the people around me, but the people around me didn't know what to do. So I didn't have that. It would have been great if I had. You ladies have me. I am at your disposal. I will be there for you, and I will encourage you. And I will also, what's great about a doula is they will help other people in the room do what they don't know what to do. And so when your mom is there or your partner is there and they don't know what to do, the doula is, come over here and do this. Come over here. Help her feel not alone. I felt very alone a lot of times when I was having a baby because my husband didn't know what to do. But then a nurse one time told him what to do, and I felt more like a team. Like we were doing it together. I was not alone. And that's huge. So make sure you surround yourself with the right people. All right, so when an epidural is given, the anesthesiologist will insert a needle and tiny tube, a catheter, into the lower part of your back. The needle is removed and the catheter left in place for delivery of the medication through the tube as needed. Once inserted, it takes about 15 minutes to fully take effect. Now, when they're putting the needle in, you're already in labor, right? You're experiencing all these pains. You have to roll over into a ball and not move. You have to stay still. It is such an intricate procedure. You don't want anything going wrong. They have to go in between these specific vertebrae. They have to go right here, do all this, and then they tape everything down. Everything's good to go as long as you stayed still the whole time. So it does ask a lot of you, and it asks a lot of the anesthesiologist as well. So, but it may be worth it for you. You may decide, nope, I'm going to go through all of that because I want that end result. I want to not be in pain. With an epidural, you can expect significant pain release, but not complete pain relief. You should expect to feel some pressure as the baby moves through the birth canal, and this helps you know when to push. What does that feel like?
Like you have to have a bowel movement.
It feels like you have to poop. That's what it's going to feel like. And that is the most exciting expression coming from a mama in labor. I feel like I have to poop. Yes, it's time. Baby is down. Baby is ready to come out. Let's push. So that is super exciting when it is time to push. So that's about pain medication. Stage 2, the birth of your baby. This is the moment we've been waiting for, doing all this work and preparation for. Stage 2 is the birth of your baby. This stage lasts anywhere from minutes to hours or more. It will take longer for first-time moms who have an epidural. Why?
Because you don't feel the urge to push.
You don't feel the urge. You might. You might ask for the epidural to start backing off a little bit at that point, so you can start to really feel that urge or feel the contractions come on, so you can open up and bear down and have baby. Your body will feel the urge to push, and your healthcare provider will walk you through pushing. So a lot of times they walk you through pushing by watching the monitor, and they will see that the monitor that they have on you is telling them, oh, you're having a contraction. Now, lots of times those monitors get moved around because there's lots going on. So not all the time are they accurate. So there's a lot of room for error there. You can push while squatting, sitting, kneeling, even on your hands and knees. Now, my most beautiful birth was I was squatting at the end of the bed. And it was the most wonderful thing, but not all doctors will do that. So ask your doctor, will you do this for me? Am I allowed to do this? Am I allowed to do that? Most hospitals will not allow you to be in any other position besides on your back. It's challenging. Say that?
Hands and knees sound more comfortable.
Then you should try it.
Squatting sounds easy. Like your body is like
You
gravity
get on
is
your
like
hands and
feeding
knees
your baby.
and like keep your knees together, but you move your ankles apart.
Where it opens up the hips.
And that works better. I'm gonna try that one.
Everybody is different.
You get on your hands and knees and like keep your knees together, but move your ankles apart.
Yep. So I hope that y'all get amazing nurses, and that the doctors will put up with the nurses. Because the nurses lots of times rule your experience. They're the ones that set you up for success. The doctor comes in and catches the baby, right? And does the repair at the end. So we need all of them. Thank goodness we have all of them. But it just depends on what kind of a nurse you get as to how much they will really set you up for success. But you can continue to ask questions and requests. Okay. To stay motivated, you might ask if you could feel the baby's head between your legs or see it in a mirror. So, I know it sounds kind of weird, but oh my goodness, it really does. When you can look down in the mirror and see that baby's head coming, you're like, oh, it's right there. And so that really does rejuvenate and help you have the energy to push baby out. A lot of our physical energy comes from our mental state. If we're feeling discouraged and feeling like the baby's never going to come out and we've been pushing for an hour and the baby's still inside me and what's going on, if we can look and see baby is right there, it can rejuvenate our mind and our spirit and our body and our psychological well-being, and we can get back in the game, all right? So this is a huge moment for us. Utilize any tool that is offered to you, and that will be offered to you. They always offer a mirror. They always offer for you to reach down and touch baby's head, so that can encourage you to keep going. After your baby's head is delivered, the rest of your baby's body will follow shortly. And what did we just talk about? We talked about keeping on pushing the whole time. Yes, I know you're going to be tired, but it's going to be way better for your outcome, for your physical outcome, if you push baby continuously out. If you've had an uncomplicated delivery, your healthcare provider may wait a few seconds to a few minutes before the umbilical cord is cut. All right, if baby is in trouble, or they're not really liking the way baby came out, or baby is kind of stunned a little bit, they're gonna cut that cord, get baby out. Get baby over here so that they can take care of baby, all right? So you might not get that baby coming out and coming on your chest and all that kind of stuff because they're concerned with baby, and that's okay. I've had it both ways. Sometimes my baby was a little bit stunned, and so they had to, whisk her away, and sometimes the baby came up on me. It just depends on your delivery. All right, stage 2, the birth of your baby. If having difficulty delivering, your baby is big or the tissue is getting tight, it may be best to have a little snip to make it easier for baby to come out. This is called an episiotomy. Where does-
what? Your skin
I was just gonna ask that question.
yesterday?
So, the this is a huge topic that we talk about all the time. So, the area between the bottom of your vagina and your anus is called the perineum. That skin right there. So sometimes baby is really big and they want to give baby a little more room so you don't tear. They'll give you a little cut in your perineum. That's called an episiotomy. So it helps open the vagina a little bit more so baby has more room to come out. So if you do not have an epidural, they will give you a little local before they snip you.
Okay.
But chances are, baby's already crowned. What do we call that? When it's burning really bad and baby's right there and pushing on your vaginal wall.
Crowning?
What?
Crowning?
It is crowning. And we very lovingly call it the ring of fire.
Oh yeah.
Where it burns and burns and burns and really all the other area around it you can't really even feel. So when they're giving you that local, you can't feel it. When they're giving you that episiotomy, all you can feel is like the movement of it. You can't really feel them cutting you. Okay, so there's a positive note. Now afterwards, they're gonna need to come back and stitch you up. Hopefully the local is still intact. If not, you can request more. Of course, they're not going to stitch you up if you don't have a local. So, because that really hurts. But they have to get you repaired so you can heal well. So an episiotomy also helps minimize tearing. So you'll tear less if they give you a little episiotomy. However, a little tear is better than an episiotomy. I'll just say that. So if you can get your doctor to do massage techniques, sounds wonderful, but it's not. It burns too. But it's a massage technique where they help you stretch. So they're rubbing and rubbing and rubbing, helping you stretch. Also, when baby is crowned, I have so much information. When baby is crowned, they may ask you to stop pushing. Why?
Oh, to hold in and let the muscles get used to
It
being
helps you
moving.
stretch. The longer it takes for baby to come out, the easier it is on your vaginal opening. Okay, the more it can stretch, because if you know, just in regular stretching, you're stretching a muscle, you're stretching something, the longer you hold the stretch, the deeper you can go. Same thing with the skin. So it can open more if it holds that stretch longer. Okay? So they may say, stop pushing, baby is crowned. At that moment, you gotta start panting like a dog. Because you want to push, your body wants to push, but you gotta hold back because the end game is way worth it. To have no tears, to have no episiotomy is such a wonderful, wonderful recovery. So it is hard work at the time, but we can do it. We were made to do hard things. All right, stage 3 is delivering the placenta. This part does not hurt. It's kind of warm when it comes out. So while the doctor is like repairing you and stuff, very well your placenta could still be in, and the umbilical cord just kind of hangs out of you while they do some repairing, checking you out, making sure you're okay. They do not leave your side, do not leave your bottom until the placenta has been delivered. You know when it's time when you start to contract. You start contracting again and you're like, oh, I'm having another contraction, that really hurts. Exactly, placenta's ready. And so you just give it another push and placenta comes out.
Can't you
And-
eat that?
Say that again.
I should eat that. Ew.
Like a cat. There are lots of studies. You can do your own research on that. There are people who will take your placenta and dry it down into capsules. And it's supposed to help with lactation afterwards and things like that. Those are the things that I've read. However, I never did it, and I don't suggest it. It just sounds awful to me. But if you want to do that, then there are ways for you to do that. All right, so delivering the placenta, let's go through. All right. Once the baby is born, the uterus will continue to contract in order to push out the placenta. This normally happens within 30 minutes of birth, and that is spot on. Your healthcare provider will examine the placenta to make sure it's intact. What does that mean, intact?
That it didn't like break off inside of you.
What happens if that happens?
What happens? What is the placenta? It's connected to you, and what is it pulling from you?
Your energy and stuff?
Nutrients, and it's
Blood.
very vascular. It's full of blood. So what is the danger there?
Blood clots.
Even more than that.
Bleeding internally?
Absolutely. Bleeding out. Bleeding out. You'll have lots and lots of blood. You'll have lots and lots of pain because it's pulling all of those things out. So it's super important. They will take really good care of you, make sure the placenta is all intact, and if it's not, they will retrieve what's left in there to save your life. All right? Any remaining fragments must be removed from the uterus to prevent bleeding and infection. After you deliver the placenta, your uterus will continue to contract to help it return to its normal size. Very healthy for you, so you're going to still feel those contractions. Just know that it's just returning back to normal. Your healthcare provider will also determine whether you need repair of any tears in your vaginal region. If you don't have an epidural anesthesia, you'll receive an injection of local anesthetic in the area to be stitched. And we talked about that already. Okay, what to bring to the hospital?
Before we start that, can I use the restroom really quick? Will I be in the way if I walk past?
Sure.
Oh,
You
no,
wanna-
you're good. Done for some phone be done.
Oh, no, you're good.
Do you want to pause it?
We can just cut it out because it'll be
Okay.
edited anyway.
Okay, perfect. We're almost finished. I didn't think it was going to take 30 minutes, but it
no
did.
worries.
It did. It took a long time. We're going to have to rush through my quiz section. Oh, good. These are the last few things. I don't think you saw this. Let me show you this. So this is the cervix when it's long and thick and hard and closed. And here it's starting to efface, 50% effaced, so it's short. See how it's shortening? And then here it's 100% effaced, so it's all the way up. So all of this thickness just shortens, kind of goes away. And then you start to dilate. So here you are, long, thick, and hard, and then it's opened up to the side. So it gets short, and then it opens up, so baby can come through. All right, what to bring to the hospital? For mom, comfortable clothes for postpartum. Loose fitting is best, elastic is your friend. Nursing bra or nursing tank. If you are nursing your baby, it's super important to wear a comfortable but fitting bra that you can snap right here, open down, nurse baby, snap right back up. You want easy. You want easy. And if you think about it ahead of time, purchase it ahead of time, wear it. A lot of them are nursing and maternity, so you can wear it while you're pregnant and just practice that little snap. Because lots of times you're only going to have one hand when you've got baby. So practice doing it with one hand and putting it back with one hand. They're awesome. Slipper socks or slippers. I always brought slippers. Toiletries that will help you feel much better. So toothbrush, your soap that you love, your shampoo that you love, all of those things, even body spray to make you feel like you're you. It's really going to help you. Printed out birth plan. What do you do with that birth plan when you get to the hospital?
Give it to the nurse.
You give it to the nurse. You make sure, hey, put this in my chart. At shift change, I want the next nurse looking at it. You know, according to my birth plan, this is what I want to do. Phone and phone charger, super important. Snacks. Of course, when you take snacks to the hospital, they're not going to let you eat it while you're in labor. So eat before you go to the hospital. Reusable water bottle, nipple cream, super important. Bring that. Adult diapers, not necessarily you're going to need to go out and buy any of those. The hospital will have tons of them for you. And they're not adult diapers. They are
Mesh underwear.
huge. Yes, mesh underwear, you're gonna want those. They are amazing. Take everything that they put in your bin, that's yours. Take it, okay? It is yours. You have once it goes into your bin, you've paid for it. So take everything that they put in there, all right? They are more like huge pads. That's what they are. And they have like wings in the front, wings in the back, and they're amazing. And they fit into those net panties amazingly. And they'll show you how to fix everything. They'll give you Tux pads. They'll give you Dermaplast spray. Use it, girl. Use it. It's awesome. Your ID and your wallet, of course, you'll need that. Insurance card and your own pillow and blanket will help make you feel very comfy. Okay, for baby, car seat is number one important. Number one. That's the most important thing because you can't take baby home if you don't have a car seat. They're going to want to see it. They're going to want to know that you have it. Going home outfit is always super cute. You don't know how big baby is going to be, so bring 2 sizes, newborn and 0 to 3. Hats or socks. You know, sometimes you can use socks on their hands if you don't have the little mittens because as soon as they are born, for some reason, they like to claw their face. I'm not sure why, but they're just figuring everything out. A swaddle blanket, your pediatrician's contact information. You'll be asked this when you go into the hospital. So if you haven't already chosen a pediatrician, it's a good idea to choose one and put their name and number down. Make sure that they're associated with that hospital. And if you don't have a pediatrician, they'll choose one for you, and they're usually amazing. Bottle and formula, if you plan to formula feed, the hospital will give you all of that. There are tons and tons. Even if you don't plan on bottle feeding, they're still going to give you formula. Take all of that just in case. They'll give you fresh nipples. They'll give you all the things that you will need. Take all of it, bring it home. You never know when it will come in handy, and you might need it for something. We do want you, if you choose to breastfeed, we do want you to exclusively breastfeed and just give that baby all the breast milk that you possibly can. Okay? All right, y'all ready? What are the 3 stages of labor?
Early labor, active labor, and labor.
So,
Delivering the baby.
Say it again.
Delivering the placenta.
Is what?
After birth.
I did say phases. Did I say phases or stages?
Stages.
Stages are early and active labor. The whole thing, all the labor. Stage 2, birth of the baby. And stage 3?
After birth.
After
Delivering
birth.
the placenta.
Yep. And then in stage 1, we have those 2 phases, right? Early and active labor. Early and active. Okay, so what do contractions do?
Dilate? No, that's
Yeah.
not it. Oh,
Help you dilate
Okay.
a face.
Yes. They
Um,
dilate, they
Thin out your
efface.
cervix. And
One more thing.
Help push the baby.
They do, yes. They help push the baby because when you have contraction, that's when you push. You don't push unless you're having a contraction. Absolutely. Okay, what are the differences between Braxton Hicks and real contractions?
Braxton Hicks are tightening
Irregular.
of your stomach. They tend to feel the same, so there isn't like, and they don't get more intense. And actual contractions, they stop you in your tracks. They're more painful, and you have to like breathe through them instead. I think
Excellent.
there's one more, but
and they're irregular.
oh yeah, they're
And are they hard to tell the difference?
No.
between Braxton Hicks and Cambridge. Yeah.
Sometimes they're hard to tell the
Really?
difference. Yes, sometimes at the beginning.
Oh.
Sometimes you're like, wait a minute, is that a real one or not a real one? Sometimes they're hard to tell the difference. Okay. Okay, what is it called when the cervix opens?
You just told me.
Mm-hmm. Uh-oh.
I forgot.
Is it dilation?
Dilation.
Okay.
What is it called when it thins?
Effacement.
Cheyenne. Of course you knew that. And what do you do if your water breaks?
Go to the hospital?
And
Call your doctor.
call, so important. You gotta call so that they're ready for you when you get there. What is the pain medication that the doc puts in your back with a catheter?
Epidural.
Who said that? Did you say? Epidural. Most of the time you can't feel your legs once you get the epidural. So that's one reason why you're kind of sitting for a long time after baby's born. Okay, during stage 2 of labor, what are some beneficial situations to look for? What stage 2?
Active labor.
Oh,
Birth of baby.
Birthing baby. So what are some beneficial situations to look for?
Positions.
Position! Yay, that was my first one. What else?
Position.
Just because you're dilated 10 doesn't mean you want to push, right?
You said beneficial
What do you-
situation.
So what? No, so, I mean, that's good because the baby's about to come out.
Letting baby descend.
What do you mean by beneficial situations? Like,
Like what to look for?
Yes.
if you have to poop, if you have feelings.
And what is that? There, the,
Pushing feeling.
yes, what is that called?
I don't know. Uh-oh.
Say it again.
Contraction?
No, what is that called when you have that feeling to push?
Urge.
I was about to
Urge,
say
that's what
pressure.
it is. And listen for the verbal cues that the doctors and the nurses give to you. What is it called when a physician makes a cut in the perineum during birth?
Episiotomy.
Episiotomy. But, okay, rule, don't eat all of these in one sitting. Cheyenne. How is it then closed together for repair? With what? What do they
They
use?
sew it.
They stitch it,
They
right?
stitch it.
Stitches. Stitches. All right, just a couple more. Y'all are rocking it. How soon after birth is the placenta usually delivered?
30 minutes.
30 minutes. All right, you're in two. And I'll need to get another one for you, Shauna. Awesome.
How come they don't deliver it immediately?
Because it's not released immediately.
Oh.
Yep.
After the cord is cut, that's when it starts releasing.
Yep. All right. Tell me 3 things to bring to the hospital for mom.
Your ID, your insurance card, and a blanket and pillow if you want to feel like more at home.
Good. And for baby, what's the most important for baby?
Car
Car
seat.
seat.
Car seat. Awesome. Oh my gosh. Y'all are amazing. Any questions for me that you're like, oh, wait a minute, we need to go back over
I
that?
have a question.
Yes.
Okay, like, I want to do a natural birth, but after I have the baby, am I allowed pain medicine?
Yes. yes, absolutely. So there are lots of different medications that they can give you. They're probably going to suggest something like Motrin or something like that. Oh, we can give you Motrin. I always ask for Tylenol 3. It has a little codeine in it, and it was always wonderful for me. It never made me feel drugged up, but it took all the pain away, helped me relax, but my brain was still there. I was able to organize and be alert. Lots of times things like Vicodin or other things like that may make you a little bit dreamy. Yeah, it might make you a little bit dreamy. But you can just use Motrin or something like that, or you can ask for something a little bit stronger.
Didn't you use Tylenol or something?
Tylenol 3. Yes, Tylenol 3. Anything else? Y'all were amazing. That was super fun. Thanks so much for joining me for labor and delivery. Great.